Hey, I'm Isaac Jordan. I'm a physical therapy student at Concordia University, Wisconsin. I'll be graduating in about 2 weeks, so getting out into practice really soon. And I'm going to be talking about my experience with interprofessional education during grad school at Concordia. So, interprofessional education, or IPE, is an educational program. So there's interprofessional education competencies, and they have to do with roles and responsibilities, values and ethics, working as a team, and then just communication. So all of it is patient-centered, knowing that the patient plays a role in decision-making in their care, and that they're at the center of the treatment plan. They're at the center of all the collaboration that all the healthcare providers do. They're part of the team that helps to optimize their own health, to bring their well-being towards where they want it to be. And this can be done a from a spiritual perspective to an emotional perspective to a physical perspective, depending on their needs, which is all kind of incorporated into the plan of care among various individuals. So interprofessional education kind of teaches us of what other professions do, their skill sets, being aware of those skill sets, knowing how to appreciate them, and really optimize patient care so that we can all work together to improve the patient experience, which is one of the aims of the triple aim of healthcare. So one other thing that interprofessional education does is that it fosters open communication within the healthcare community. So during patient care, there's not as much of the nervousness of saying, "Oh, well, I don't know," or "I don't know what to do. What should I do with this person?" It really fosters that team environment, so that there's no pride of, "Oh, well, I can figure it out and it's just me," but it's rather a team approach, and we openly communicate with other professionals, because it's not about us, it's about the patient, and it's about what they need, and we're very open to collaborate and discuss in a non-judgmental and non-threatening manner with other care providers of the best route forward with people. So it kind of fosters that kind of environment of healthcare. And another thing that it also does is embraces the diversity of a diverse healthcare team and a diverse patient population. So it looks at the strengths of different cultures and how we can value those and how we can help to optimize the patient experience for people who maybe have a very different culture from what we do as care providers. There's 4 key competencies, and each has plenty of sub-competencies, so there's a lot that it entails. And it really is kind of paving the way for a more collaborative healthcare system moving forward. Personally, before I started graduate school, I'd never heard of interprofessional education. I had grown up with a lot of family members in healthcare, and I went to a health professions academy in high school, and I never heard of interprofessional education, but I did get to develop a great appreciation for a lot of different fields, studying with the aim of being a physician assistant. Before going to physical therapy school, I decided to change my mind because the more you learn about professions, the more you can kind of hone your skills towards the one that you feel you resonate with most. And so that was kind of where that led me, but I had so much experience shadowing other professions and seeing how they do their work and seeing how they work with patients, how they work with other care providers. So I loved that environment, and IPE is fostering even more of a strong environment of that collaboration and that team environment in the hospitals and in clinics, and just in general communication throughout the whole healthcare system. So going into grad school, we started doing these things called IPE events, and we were told we have to make an elevator speech of our own profession, and a lot of us in that first year of school, we were just trying to grasp the concepts that we were learning and grasp our own profession, so as physical therapy students, like, what do physical therapists all do? What are we known for in the healthcare field? We didn't even have a great understanding of that yet as first year students. Some of us did more so than others if we had a lot more experience shadowing, but this gave us an opportunity to really learn about our own profession and look to the professional world about what physical therapists do, but then also learn from occupational therapy students and nursing students and pharmacy students, social work students, all that they're learning and their skill sets too, so that when we eventually did get into our clinical rotations, a lot of that was more familiar to us. So I did, even though they were really infrequent, there was only 1 or 2 per semester for a couple hours. Going into the hospital system, I felt very comfortable about knowing how to talk to nursing staff and knowing how to talk to doctors, knowing how to talk to pharmacists, because we had done so much work together with other students where they spent a lot of time helping to explain to us what they do, and also seeing all the things they think about with when they're going to see a patient and when they're going to evaluate a patient. So that really helped with going into clinical rotations, and I had clinical instructors that really pushed trying to communicate with professions, and that ended up being one of my favorite things to do, is communicate with other team members from different disciplines so that we could optimize patient care. And I don't feel like I would have had that if we hadn't done as much work as we did with interprofessional education and throughout the semesters of grad school with all the support from the IPE team. So really now, going into practice soon, I look forward to working together to advance the healthcare system, to optimize patient care, and make it a more sustainable and compassionate and understanding system, both for the people that work for it and for those who find themselves under the care of all the different providers that have their specific skill sets in the system. So thank you for taking the time to listen, and I look forward to collaborating more in the future, and all the best to you.